of the child cannot be taken frequently just because we lack this small equipment. Can you imagine that our emergency system, although it is organized, but it is organized on the papers. It doesn't work because we don't have adapted equipment. It doesn't work because we don't have enough people who have been trained, although there's an effort from the government to train specialists on this field of emergency. But how many are there? What type of equipment do they have? How can they use the equipment? How the system works to refer and so on. For the emergency, we still also have problems. And the government have been becoming more and more conscious to make sure that something should be done about this problem of emergency. That we still at the level of thinking on how to make good use of all the strategies that have been put in place. But the most important thing there is that there's no equipment, the drugs are not there. It is difficult to use even those kind of resources that they have about emergency. If you now go at a district hospital where you found doctor, generalist, you will find that in some area you have only one doctor for about 300,000 people in remote area. Sometimes you have two, but you hardly have three. If you want to make an average, we can say we have one doctor for more than 50,000 people in the remote area. If you now go to the town, you can easily find one doctor for 10,000 and even 10,000, 15,000, and in some area you can find one doctor for 5,000 and maybe one doctor for less than 1,000. It depends. But what we should keep in mind is that in the remote area, the doctor who is there is supposed to do everything. He have to perform consultation. He have to do surgical operation. He have to support nurse in the delivery. And he have to make sure that he's taking care of everybody who is sent to him. So for consultation, he can receive sometimes 5 new patients a day, but in average it is between 10 and 15, with on Monday sometimes 40 new cases. If you go to the town where in at the level of the DC hospital, you will see that a doctor there can receive between around 30 people in average daily in his consultation. But with time, doctors are now trying to bring this number down, but bringing the number down also have a consequence. That means some other people are left on the side of the road and they cannot benefit from the system. Anyhow, things are organized, but they need a lot of improvement. They need a lot of improvement. If I can summarize, you have, for what concerns diseases, malaria, AIDS, tuberculosis, parasites, diabetes, cardiology, a lot of road accidents. I have forgotten, a lot of road accidents, and too many problems who ask emergency action. We have a problem of equipment. The equipment who is there now is a very old equipment, sometimes more than 10 years in average. Hardly maintained equipment. People are not always aware of how to make a good use of this equipment. You have a problem of information of the population. We have a problem of health information from collection to the use of this information. We have to improve on the training, the continuous training of people. I can assure you that basically people are well trained, but with time, without any continuous training, you can understand that things are not going to remain the same after 5 or 10 years. We have problems of infrastructure, and we have to improve on our equipment. I have said that already. So I think I'm going to stop there. And if there is a possibility again, I'm saying that we need an interactive talk so that I can give more explanation. And I will not finish without saying that we need to improve on the access of the community to good health services and make sure that this community really benefit from the donation people will give and from the donation from elsewhere and even from the effort of the government and the entire population. Thank you.